So here's the structure of the skin. Now, what you'll notice about the structure of the skin is that we have three clear layers. We have the epidermis, the dermis, and the hypodermis. So this is actually the top of your skin, okay, at the epidermis, and the cells are actually born of this epidermis here at this wriggly layer. As they grow, they begin to flatten and lose the material inside their skin, inside the cell membrane, and they become more keratinized and flat and thinner. And you can see those layers as they go up. By the time you get to this very top layer here, these are very dead, flat keratin fibres or cells. Next we have the dermis, which is the working part of the skin. And you can see here that we have our hair follicle here, which goes with the hair shaft above the skin. We also have sweat glands that make our sweat, and they have a long tube that again runs to the surface of our skin, and the hole at the top is called a sweat pore. We also have our sebaceous glands that sit beside each hair fibre, and they again produce a thick oil that coats the hair and makes it smooth, but also moisturises our skin and protects it from things like sunburn and dryness and flaky and eczema. We also have our veins and our arteries. So when they're small and near the surface of the skin, these are now called the venule and the arteriole. And as they get right up into the dermis, you can see they get even smaller and thinner, and they become capillaries. What these do is they deliver blood from the heart in the arteriole, and it's red, so it's oxygenated blood, and it's providing that oxygen that the cells in the skin need, dropping it off, and then once it's deoxygenated, it's lost its oxygen, it returns back to the heart through the venules and eventually the veins. Other things you can see here are the motor nerve and the sensory nerve, and there's a lot of different nerves in our skin, and that's how we feel through our skin. At the very bottom layer here we have the hypodermis, and this is mainly adipose tissue or fat. So if you're carrying a lot of fat in one area, you'll have very thick adipose tissue, and if you are carrying only a small amount of fat, you'll end up with a very thin adipose tissue layer. It is important that we have adipose tissue because it's like a soft, squishy cushion that helps protect our skin. It's also where if we were doing liposuction on this person, we'd actually put a big needle in through this layer of skin and we'd suck out the excess adipose tissue from inside here. Okay, this is just some brief information, just a recap. So the epidermis is that top layer of skin. It's made up of dead, flattened, keratinized cells on the top and germinal cells at the base. And we call germinal cells stem cells. You may have heard of stem cell therapy. These ones can only become skin. They can't become anything else. But you can have stem cells in your body that can produce any cell in your body. Some of the stem cell therapies are now looking at adult stem cells, and that's what they mean by adult stem cells, that they're coming from this layer underneath the skin or in your bone marrow. The epidermis grows through the germinal layer, which is at the bottom. The cells divide here and they push up the older cells. As they're pushed up, they slowly die and flatten, and then eventually they flake off and shed. And this cycle happens every 4 weeks. So every 4 weeks you get a new layer of skin. So the dermis is the working part of the skin, as I said. It contains hair follicles, nerves and glands. The space in between is filled with fibrous cells and collagen. You may have heard of collagen in advertising, that they often say beauty products like special moisturisers have a lot of collagen, especially the anti-aging ones. Collagen naturally is an elastic protein that allows our skin to stretch and gives our skin scaffolding or structure. So it's what prevents wrinkles. The trick is, though, that for this collagen to actually work to plump our skin and to reduce wrinkles, it has to get through the epidermis. So one of the questions for all of us as consumers is, will that happen when we buy a moisturiser and we wipe it on our epidermis? So just a quick recap of the structures within the dermis. Here we have the hair follicle. Remember the hair follicles at the bottom, hair shafts at the top. Along the side of those is the sebaceous gland that produces oil. We have the sweat gland that opens up through the sweat pore, and that's what removes ammonia-based wastes from our skin. And we have the blood vessels that bring the oxygen and take the deoxygenated blood away from the skin. And we also have the nerve endings. And here I've pointed out 4 different types of nerve endings, and you may have heard about these in science as well. So here we have the thermoreceptors that sense heat and cold, and they look like a little bubble with a tail. The tail, of course, is going toward the spine and eventually will send those messages up to your brain so that you can feel hot and cold. The Meissner's corpuscles senses touch. So here we've got a feather tickling the skin. That will set this nerve receptor off, and that will send a signal again to the brain. The nociceptors sense pain, so like hot, sunburn, or a pinching needle. And the Pacinian corpuscle senses pressure, so a pinch or a pull or a push. Now we're going to go through some of the issues that relate to the skin. One of them is acne, and acne is a very common problem in teenagers. And here you can see a normal cross-section of the skin and a cross-section of the skin with acne. And you can see that here the hair follicle is broken quite a far way down. The hair follicles become blocked, the pore at the top has become blocked, and in this space here of the hair follicle, we've got bacteria growing, and that's causing an infection. Inflammation means white blood cells come to their aid, and that's the thing that squeezes out of a pimple. If you've ever popped a pimple, or not that I recommend that, but that's what that white bit is it's the leftover inflammatory tissue. You can see here with aged skin that here we've got the collagen fibres in the young skin, and here we've got a lot less, and that's caused the epidermis to wrinkle and fold. Different skin colours are produced by these cells called melanocytes, and they're found at the very bottom of the epidermis in that germinal layer, and they can stretch up into those cells as they grow up. It's the melanocyte that causes the skin colour through a pigment called melanin. So melanin is these little pigment crystals inside. And if a melanocyte starts to divide uncontrollably and you get a mass of these, you can start forming moles and eventually skin cancer. Moles don't necessarily turn into skin cancer, but they are a collection of melanocytes that have grown there and then stopped. So they're called benign. As you can see, different amounts of melanin produce different skin colour pigments, and you can see that there's quite a variation amongst the world. Dark-skinned people have more melanocytes, albinos have no melanocytes, and freckled people have an unevenly distributed layer of melanocytes, so they'll have clusters in one spot and not. To get sunburn, you need to have UV light. If you have here, we've got all the electromagnetic spectrum here. You can see that the wavelengths over here are very short and the ones over here are very long. When we're talking about ultraviolet light, the UV rays that we hear about in advertising, we're talking about right on the outside of the visible light spectrum. So we can't see them, and they've got quite short wavelengths, which means that they're small enough to fit in between the gaps between cells and get right down to those melanocytes. When that happens, as you can see, UVA is a bit smaller than UVB, so it penetrates deeper, and the deeper it goes, the more likely it is to tickle those melanocytes and cause a change that turns off the gene that controls how often it divides. When it divides uncontrollably, we end up. When the UV light penetrates down deep into that dermis, striking those melanocytes, it can cause changes to the DNA of those cells. When that happens, you can turn a very benign mole, a collection of melanocytes. Benign means that it's not harmful, it's just sitting there. Okay, you can turn that very benign mole into a malignant mole. And a malignant mole means that it's now a cancer, and malignant means that it can spread. Identifying skin cancer should always be done by a doctor. By no means am I asking you to self-diagnose yourself with skin cancer, but if you have a mole that worries you, it's very important to go and see a doctor and get it checked out just in case. As you can see, there's quite a range of different benign moles. So if they're symmetrical, so they're even on this side and that side, if they've got very even edges, if they're all one colour, or if they're smaller than 6 millimetres, chances are they're normal and fine. But as you can see, there's quite a variety of different benign moles there as well. But if it starts to become asymmetrical, an irregular pattern, the edges start blurring, it might have more than one colour, or grows larger, then it's a good idea to get those checked out by a doctor. Another name for skin cancer is melanoma. So you can see at the start of the word melan comes from melanin or melanocyte, all meaning that it's the same root, no matter which one, and oma means cancer. So melanoma means cancer of melanocytes. So the stages of melanoma, you can see here in the first stage, very early detection, it's all up in the epidermis. You can see the germinal layer here. As it gets more and more developed, you can see it is extending further and further into the dermis, which means it now has access to blood vessels, and blood vessels means that those cells can spread to other parts of your body. By the time it's getting right down here to your subcutaneous tissue, your chances of damage when you're removing it's a lot higher, and the chances that it's already spread are a lot higher. So if you can pick it up here when it's only very small melanoma, you get a lot greater chance of successfully removing it than if you let it go right up to the end stage. So you may have heard the controversies about sun tanning beds. It's been in the media a lot, and a lot of it's been caused by the death of this young lady here. She'd only ever been sunburnt through using sun tanning beds, and she used them quite regularly. She ended up with skin cancer very quickly, and she actually passed away in her early 20s. So skin cancer is not just something that affects older people, it can affect young people too. And the problem with sun tanning beds is, as you can see, this blue light that they produce is all UV rays. So what you're doing is you're getting a very concentrated, very sudden dose, and yes, it makes your skin go brown, but it's also making those cancerous changes in your cells. So one thing I'd like to raise with you is that there is actually no such thing as a safe tan. We do need to try and prevent sun damage, no matter which way that we're getting that exposure to those UV rays. And this is an old campaign that's been around for a long time, the slip, slop, slap, seek, slide. And basically it tells you to slip on a t-shirt, slop on some sunscreen, slap on a hat, seek some shelter, and slide on some sunnies. And if you're doing all of those different things, you're protecting yourself from sunburn. And of course, not all sunscreens are the same. The higher the number on them, and this one is 30 plus, and that's the highest that we can rate a sunscreen at the moment in Australia. The higher the number, the more sun protective it is. So what is a sunscreen? Why do we bother using them? It sort of looks like moisturiser, doesn't it? And yet we know that it stops us from sunburning. So one of the things I'd like you to be thinking about are, what are the main ingredients of sunscreens? How do they work? And what is this word SPF, this acronym? So sunscreens work by combining organic and inorganic active ingredients together to block the light. So the inorganic ingredients, zinc oxide and titanium oxide, reflect and scatter UV light radiation. So by reflecting it and making it scatter, it's not going down into your epidermis and affecting your melanocytes. The organic ingredients like octyl methylcinnamate or oxybenzone, they absorb the UV radiation. So they're actually soaking it up instead of your skin soaking it up. And they dissipate the heat, which means they spread it out so that it's not affecting a really narrow area. It's spreading across quite a large area, which is why you'll still feel warm when you're wearing a sunscreen. So some sunscreens protect us from two types of the damaging UV radiation, which is UVA and UVB. UVC doesn't get blocked by sunscreen, so it can still have a damage, but both of these two types cause sunburns and the damaging effects on the skin, like skin cancer and aging. SPF means the Sun Protection Factor, and basically it's an equation that helps us work out how long we can stay in the sun when we're wearing that product. So if you take the time you'd normally burn in the sun without protection, say it was 20 minutes, okay, 20 minutes will normally produce redness on a light-skinned individual. Then if you multiply it by the SPF of the product, it tells you how many minutes you can now stay in the sun without burning before you have to reapply that sunscreen. So if you've got an SPF of 15 and you can stay in the sun for 20 minutes, then the total time you can stay in the sun is now 300 minutes. Okay. If you want to know how long that is in hours, you would have to divide it by 60, and that tells us that we could stay in the sun for 5 hours. Now, we know that if you're in water or if you're sweating heavily or at all, any moisture is going to help wash that sunscreen off your skin, and so you'll need to reapply it more often, which is why we recommend that it's reapplied every 2 hours. So now it's your turn, your job. I want you to think very carefully about that structure of the skin and explain how exfoliants work. So you've probably exfoliated at home as part of your normal beauty routine, but how come your skin looks smoother and clearer after exfoliation? Which part of the skin are they actually targeting? I want you to use your knowledge of skin structure and UV light to explain why people are more likely to get burnt in summer than in winter. If a person gets sunburn after 20 minutes without sunburn, how long will it take with SPF 30 sunscreen applied? And what would happen if a person was born without an epidermis? What would their life be like? And the last question, I want you to explain how you can cut yourself like a paper cut and not actually bleed. As a follow-up from this, we will be doing a quiz, so make sure you do your work and answer it before the next lesson.